Hey everybody, it's Logan and Caroline here. Hunter's asleep right now, so we thought we would update you on Caroline's pregnancy with our second child. As you know, she had a conversation with a geneticist a while back, and they said they wanted to do an NIPT test, which is non-invasive prenatal testing. That's what that stands for, right? So we got the results back. We're going to share with you the results at the end of the video. But first, to fill you in, if you're not aware of what's kind of been going on with us and with Caroline's pregnancy, let's kind of start from the top and kind of say what was going on. So on Caroline's, what do they call them? First and trimester screenings, right? First and second trimester prenatal screenings, right? Yeah. Is that what they call them? She was low for her Papp-A.
Papp-A. Yeah.
Papp-A, I think that's how it's referred to, which is pregnancy-associated plasma protein A. So a low Papp-A is associated with low birth rate, miscarriage, also chromosomal disorders such as Down syndrome, which is Trisomy 21, which means there's a third copy of the chromosome 21, or Edwards syndrome, which is Trisomy 18, which means there's a third copy of all or part of chromosome 18. So, but on that screening, there wasn't really much concern. I think the risk assessed for Down syndrome was like 1 in 68,000. But the risk for Trisomy 18, Edwards syndrome, the risk was 1 in 180. So, but still, they didn't think that warranted doing NIPT at that point. So, I don't know much about Papp-A. I think it has something to do with the placenta function or something like that. I don't know. Again, we're not doctors. We're not medical professionals. Nothing in this video should be taken as medical advice. Then what happened? Then you had right. So we had the ultrasound, the anatomy scan. So Caroline had the anatomy scan. On the anatomy scan, they found 2 soft markers for chromosomal disorders. One of them, excuse me, is called ECHOGENIC INTRACARDIAC FOCUS, which basically appears on the ultrasound as a bright spot in the heart. This actually appears in 3 to 5% of normal pregnancies, and even more so in pregnancies where one or both parents is of East Asian descent. Okay. The geneticist says that is a soft marker for Down syndrome. But Down syndrome wasn't really what the geneticist was really worried about, because of the prenatal testing. It showed like a 1 in 65 or 68 risk of 1 in 65 or 68,000 risk for Down syndrome. She was more concerned about Trisomy 18, which is Edwards syndrome, which is often fatal. The baby often does not, even survive till full term, and the baby will often have a lot of problems, like more problems than Down syndrome. Like Edwards syndrome, Trisomy 18, it affects like every aspect of like the child's development. Okay, so the first soft marker they found on the ultrasound was that echogenic cardiac focus, the bright spot in the heart, has an association with Down syndrome. The second soft marker they found on the ultrasound is Choroid Plexus Cyst, which is basically a tiny bubble of fluid in the brain. This is found in 1 to 2% of normal pregnancies, but it does have an association with Edwards syndrome, Trisomy 18. I think both of these have some kind of soft association with both, but the choroid plexus cyst is especially, I guess, associated with Trisomy 18. So that's kind of the long explanation of why we took this test called NIPT, non-invasive prenatal testing, I think is what it stands for. But we got the results back, and I'll put them up here. So the results were negative. So it says the results were consistent with 2 copies of chromosomes 21, 18, 13, which is normal, and 2 sex chromosomes XY, consistent with male fetus. So, we're thankful that the NIPT test came back negative. We're just very thankful for that. One thing, so Caroline actually had an OB appointment just right now, and the OB said that she's still low Papp-A. And so they want to kind of monitor her blood pressure, because apparently that could cause high blood pressure. So, yeah, that's just kind of what we're dealing with right now. Thank you so much for thinking of us for praying for us throughout this pregnancy. We'll continue to keep you updated on anything that we think you all should know. Bye-bye.